Hello friends, we are going to discuss about various type of leukemia. First of all, ALL. There are two types of mainly ALL, TALL. TALL due to gain of function mutation in Notch1 gene. Notch1 gene. Notch1 look like T. So gain of function mutation. Number one always is stand for gaining. So gain of function mutation. Next is BALL. BALL is loss of function mutation in PAX5 and E2A gene. PAX5, E2A gene. P looks like B and E if it A, then it is looks like B. So it is loss of function mutation. Loss of function mutation. Next, there is another term is called mediastinal mass or superior mediastinal syndrome or sternal tenderness. Sternal tenderness. T associated with TALL is also called superior mediastinal syndrome. Superior mediastinal syndrome. Next, what is the good prognostic factor or bad prognostic factor in case of ALL? Good prognostic factor. ALL has three letters. So good prognostic factor means gene translocation T1221. There is three letters. There is three letters. Next, hyperdiploidy. Hyperdiploidy. So greater than 2 is 3. In any case of cancer or carcinoma, in extreme ages are unfavorable factors. So in case of good prognostic factor is 2 to 9 years age. Next, what is the bad prognostic factor? What is the bad prognostic factors? Bad prognostic factor, age less than 1, greater than 10 years. Next, pseudodiploidy. Pseudodiploidy. Next topic is AML. Next topic is AML. AML. There are some clinical features in AML, acute myeloid leukemia. First, chloromas. 2, DIC. 3, gingival hyperplasia. Gingival hyperplasia. We are all known there are various type of AML like M0, M1, M2, M3, M4, M5, M6, M7. But there are MCQs which are asked which subtypes of AML are associated with these clinical features. In case of chloromas, it is associated with M2. In case of DIC, disseminated intravascular coagulation, M3. In case of gingival hyperplasia, M5. Now is 5G. And there are various types of genetic factors in case of AML, like Down syndrome. Down Dhoni, so it is associated with M7, MST. Next is Bloom syndrome. Next is Fanconi's anemia. Fanconi's anemia. We should remember that AML is not associated with Fanconi syndrome. Fanconi syndrome not associated with AML. So what is Fanconi's anemia? Fanconi's anemia is abnormal chromosomal fragility. Abnormal chromosomal fragility. There are some important points in AML. First, leukemia cutis. Leukemia cutis. Most common in AML. Next, Aurods. What is Aurods? Aurods are made up of lysosomes. Made up of lysosomes. Made up of lysosomes. What is Fagot cells? Made up of Aurods. In which subtypes we can see Aurods? It is M3. It is M3. Mainly in M3 we can see Aurods. Next, what is the treatment in AML? Treatment of AML. All trans retinoic acid. Treatment of AML. Next is CLL, chronic lymphocytic leukemia. Chronic lymphocytic leukemia, CLL, chronic lymphocytic leukemia. There are important points regarding CLL. First, never develops after radiation. Never develops after radiation, first of all. Second, in case of PBS, peripheral blood smear of CLL, we can see convent gall appearance. Convent gall appearance or smudge cells. And it is the most common leukemia in adult. Most common leukemia in adults. But the drug of choice is CLL, fludarabine. Fludarabine. So what is the drug of choice of CLL? Fludarabine. Next is mantle cell lymphoma. Next is mantle cell lymphoma. mantle cell lymphoma. In case of AIM, if we erase these two arms of AIM, we can get 11. So, what kind of gene translocation in mantle cell lymphoma? T1114. What's the marker of mantle cell lymphoma? SX11 marker. An overexpression of cyclin 1. So 11, 1, 11, 11. An unusual presentation of mantle cell unusual presentation. It is an important MCQ. Lymphomatoid polyposis. Lymphomatoid polyposis. What is lymphomatoid polyposis? Mucosal involvement of small bile or colon producing polyp-like lesions. Mucosal involvement of small bowel or colon producing polyp-like lesions. Next is follicular lymphoma. Next is follicular lymphoma. Next is follicular lymphoma. F for 5, F for fuck. So, in case of follicular lymphoma, there is a 5, but 5 is negative. CD5 negative. And in fuck, there are two people. So, BCL2 overexpression. And it is generally started in 18 years age. So, gene translocation is T1418 and CD5 negative, but 18, so CD18 positive. 18 plus 5 equals to 23, so CD23 positive. In case of follicular lymphoma, histological transformation occurs to DLBCL, diffuse large B-cell lymphoma, and Burkitt lymphoma, diffuse large B-cell lymphoma and Burkitt lymphoma. So, what is diffuse large B-cell? There is another point in follicular lymphoma. It is the most common form of indolent non-Hodgkin lymphoma. Most common form of indolent non-Hodgkin lymphoma. What is the meaning of indolent? Low grade. Next is diffuse large B-cell lymphoma. Diffuse large B-cell lymphoma. Most commonly asked, most common form of non-Hodgkin lymphoma. Most common form of non-Hodgkin lymphoma in India is diffuse large B-cell lymphoma. Next is multoma. Multoma M arise from memory B cell. Next, arise from inflammation. In inflammation, H. pylori infection. Next, Sjogren syndrome. Next, Hashimoto thyroiditis. Hashimoto thyroiditis. Most common site for extranodal lymphoma is stomach. Most site for extranodal lymphoma. Most site for extranodal lymphoma is stomach. Next, Burkitt lymphoma. Burkitt's lymphoma. So, most common cause of tumor lysis syndrome is Burkitt's lymphoma. MYC gene mutation. MYC gene mutation. What is the gene translocation? B resembles like 8. So T8 14. And it has high mitotic index. High mitotic index means Ki 67 100%. Ki 67 100%. And B looks like 6 also. So BCL6 over expression. And in case of morphology, it shows starry sky appearance. Starry sky appearance, cytoplasmic vacuoles or and cytoplasmic vacuoles. Next is hairy cell leukemia. It is associated with splenomegaly. Splenomegaly. And mutation is BRAF V600E. BRAF V600E and anoxin A1. In bone marrow biopsy, we see honeycomb, fried egg. Fried egg looks like also honeycomb and chicken wire mesh. chicken wire mesh. Another important point in case of hairy cell leukemia is cytochemical markers for hairy cell leukemia is TRAP, tartrate resistant acid phosphatase. Tartrate resistant acid phosphatase, and it is mostly associated with atypical mycobacterial infection. Atypical mycobacterial infection. So, what is the drug of choice for hairy cell leukemia? Here in Bengali it is chul. So, drug of choice is clarithromycin. And there are a syndrome named sweet syndrome. If we call a girl sweet, that means he's hot. So it is fever. In case of fever, it is an infection or inflammatory response of the body. So neutrophilia. And a girl looks like sweet when is red in red cheeks. So pinkish red edematous plaque. Edematous plaque. Why it is dense dermal infiltrate of neutrophils. It is associated with most commonly AML, SLE, and IBD, inflammatory bowel disease. Inflammatory. So, a girl is sweet. Hot, fever, pinkish red edematous plaque, and neutrophilia. Next is in case of bone marrow aspiration. In case of bone marrow aspiration, which leukemia shows dry tap? Which leukemia show dry tap is an important MCQ for NEET PG. First, hairy cell leukemia. Just imagine here, they're dry, they're dead cells. So hairy cell leukemia always dry tap. Here means dead. So it is dry tap. Next is myelofibrosis. Myelofibrosis. So again, fibrosis means dead. So it is also dry tap. Myelodysplastic syndrome. So dysplastic always dry. Next, CML. and AML. But in follicular lymphoma, it is never dry type. Cause follicular means fuck. Fuck cannot be dry, cannot be dry. That's all.